Without objection.
Mr. President, I rise today to speak once again on the failures of the so-called Affordable Care Act and what they mean for hardworking families and taxpayers. Now, this is far from the first time that I've come to the floor to talk about Obamacare. Indeed, over the past several years, I don't think I've spoken as often about any other topic, and I'm not alone. Since the time Democrats forced the Affordable Care Act through Congress on a series of pure party line votes, my Republican colleagues and I have been speaking out about the poor judgment and short-sightedness that has unfortunately defined the trajectory of this law from its drafting to its passage and now well into its implementation. And quite frankly, we've had plenty of ammunition. Seems like we're treated to at least one new Obamacare horror story every week. My friends on the other side of the aisle have done their best to downplay our criticisms and minimize every negative story written about the problems with Obamacare. In fact, just this morning, the Senate Minority Leader came to the floor to pronounce the Affordable Care Act a success. But the American people have long recognized the truth. Obamacare isn't working, and it never will. This isn't a matter of opinion, Mr. President. This isn't just political rhetoric in an election year. By its own standards, and the standards of those who drafted, passed, and implemented the Affordable Care Act, Obamacare has been an historic failure. Case in point, the American people were promised that Obamacare would bring down health costs. But in reality, costs are continuing to go up. Over this summer, as we've moved ever closer to the next open enrollment period for the Obamacare insurance exchanges, we've learned that insurers throughout the country have submitted requests to raise premiums by an average of 18 to 23% over last year's premiums. For some plans, the requested rate hikes are significantly higher than that average, coming in at more than 60% according to some recent reports. Consider the following expected rate increases. In California, policyholders can expect a 13% average increase in premiums, which more than triples the increases seen in the past 2 years. In Florida, they can expect a rate increase of 19% on average over this year. In Nebraska, they can expect an average increase of 35%, with some rates increasing by nearly 50%. And in Wisconsin, rates are expected to increase on average by as much as 30%. These numbers are more staggering when you consider that when the law was passed, the Congressional Budget Office projected rate increases of about only 8% at this point. By some estimates, premiums for silver plans, the standard metric, are expected to increase 11% more than they have at any point since Obamacare was implemented. While some of my colleagues have claimed that the evidence of massive premium increases is mostly anecdotal, and that tax credits help blunt the overall cost increase, they simply cannot ignore the facts. Premiums in the Obamacare insurance exchanges are going up in markets throughout the country, and according to CBO, the Congressional Budget Office, 12 million individuals are estimated to have to pay the full price next year because they either are not eligible for credits or they will choose to purchase coverage outside of the Obamacare exchanges. What is more, the middle class is increasingly bearing the brunt of these increased costs. As the Wall Street Journal recently reported, middle-class families are spending 25% more on healthcare costs, which reduces their spending on other necessities. David Cutler, a healthcare economist from Harvard, is quoted in the article as saying, when it comes to healthcare, it is, quote, a story of three Americas. One group, the rich, can afford healthcare easily. The poor can access public assistance. But for lower middle to middle income Americans, the income struggles and the healthcare struggles together are a really potent issue, unquote. Our focus should no longer be on the question of whether premiums are going up. We should instead be trying to figure out why it is happening. And in the end, there are a lot of reasons why Americans are paying more for health insurance under a new system that was supposed to help them pay less. But the overall explanation is actually pretty simple. The president's health care plan was poorly designed, and they know it. If you recall, when my friends were drafting and passing the Affordable Care Act, they claimed that the system they were putting in place, complete with higher taxes, burdensome mandates, and draconian regulations, would entice more people into the health insurance market. And with a larger pool of insured individuals, my colleagues on the other side of the aisle argued that insurers would be able to keep pace with all the new requirements imposed under the law without passing costs on to patients. We now know that these projections were, to put it nicely, foolhardy. From the outset, enrollment in the Obamacare exchanges has lagged behind the rosy projections we saw when the law was passed. And as time has worn on, more and more people have opted to pay the fines instead of purchasing health care on the exchanges. In February 2013, CBO projected that more than 24 million people would be enrolled in the exchanges. As of this past March, the actual number was less than half of that number. My colleagues, in their desperate attempts to defend the health law, tend to focus solely on the number of uninsured people in the United States, a number that has admittedly gone down in recent years. However, what they tend to leave out is the fact that the vast majority of newly insured people under the law haven't purchased insurance through the exchanges. They've enrolled in Medicaid, a fiscally unsound program that provides less than optimal coverage options for patients. In fact, there were 30 million people without insurance, which was the reason we enacted the law. At least that was the argument. Today, there are probably at least 30 million people without insurance. The Washington Post recently ran an article on the enrollment shortfalls in the exchanges, plainly spelling out the issue, saying, quote, "Debate over how perilous the predicament is for the Affordable Care Act, commonly called Obamacare, is nearly as partisan as the divide over the law itself. But at the root of the problem is this: the success of the law depends fundamentally on the exchanges being profitable for insurers, and that requires more people to sign up," unquote. Long story short, Mr. President, people are not signing up on the exchanges in the numbers that were promised. As a result, health insurance plans have been forced to adhere to the law's burdensome mandates and regulations without the benefit of an expanded and healthier risk pool. So, as we've seen in recent months, plans in many of the exchanges have reported massive losses, leading a number of major insurers in important markets throughout the country to terminate their plans altogether. The result? Patients and consumers are being left with fewer and fewer options. According to a recent study by the Kaiser Family Foundation, nearly 1 out of every 3 counties in the United States is likely to have only one insurance health option available on the exchanges in 2017. Another third of U.S. counties will only have 2 options available. Thus, what had been approximately 35% of the counties with 2 or less options on exchanges is likely to nearly double to around 67%. Excuse me. Furthermore, more than 2 million individuals are expected to have to change plans for 2017 as a result of insurers leaving states, which is nearly double compared to those who had to switch carriers at the end of last year. You don't need a PhD in economics to know that, generally speaking, fewer options means higher costs for consumers and lower quality products being offered. And that's exactly what the American people are dealing with when it comes to health insurance. This includes people from my home state of Utah. For example, one of my constituents, Mr. Chris Seacrest, wrote to me saying, quote, "Since the new health care law was forced on us, my premiums along with my deductibles have skyrocketed. With my premium deductible and, quote, within a quote, out-of-pocket, unquote, expense, my total out-of-pocket expense for insurance now tops $20,000 per year. Can anyone explain how this can be considered, quote, affordable health care, unquote? In addition, over the August recess, I met with the Utah Board of Directors of the Leukemia and Lymphoma Society, and there I heard from many Utahns about the skyrocketing costs of care over the past 3 years. These constituents repeatedly emphasized that they had initially hoped that Obamacare would help them, but in their experience, it had only made things worse and much more expensive. The downward spiral of Obamacare is a circle that cannot be broken without some kind of intervention. And while there are a number of ideas out there to address these problems, there are really only two major paths we can take. We can enact reforms that are patient-centered and market-driven, or we can expand the role of government in regulating, mandating, and, in the end, paying for more and more of our healthcare system. Republicans in Congress, myself included, have proposed plans that would take us down the first path toward more patient-centered reforms. Our friends on the other side, when they're not doubling down on the dismal status quo under Obamacare, are advocating for even more government involvement. Case in point, the Democrats' nominee for president has outlined a number of, quote, reforms, unquote, she'd like to add to the, quote, progress we've made, unquote, under Obamacare. And each of her proposals amounts to an expanded role for the federal government, including the renewed idea of the so-called, quote, public option, unquote, or a government-run plan. In other words, in this election season, the Democrats' answer to the failures of Obamacare is more government control of their health care system. It's funny, Mr. President, beginning in 2009, when the health law was being finalized, I argued that Democrats intended to keep expanding the role of the federal government in health care to the point where they could argue that the only workable option after a series of failures would be to create a single-payer health care system. In other words, socialized medicine. Some pundits and even some of my colleagues declared that I was paranoid, that I was trying to scare people into opposing Obamacare. Yet 7 years later, those claims look relatively prescient, if I do say so myself. Faced with the failure of Obamacare to live up to its many promises, my colleagues are not arguing for a change in direction. Instead, they're clamoring for more authority to dictate the terms of what had been a private health care marketplace before. And in a world where the government dictates both the products on the market and the prices at which they're sold, the eventual result is a marketplace in which the government is the only available provider. In other words, Mr. President, while many of my friends on the other side will deny that they want to create a single-payer or socialized medicine healthcare system in the U.S., that is the direction they have us headed. Fortunately, Mr. President, the march toward a single-payer system is not a fait accompli. We can take action to right this ship now. We can control costs. We can take government out of the equation and give patients and consumers more choices. Of course, to get there, more of my colleagues on the other side will have to acknowledge the failures of the current approach and agree on the need to plot a new course. Perhaps once the upcoming election is over, we can begin to make progress on these issues. It is my hope that with the current administration in the rearview mirror, people will be more willing to acknowledge the failures of the Obamacare status quo. Of course, I recognize that the coming election might embolden those who support greater government involvement in the healthcare sector to try and take us further down the path towards a single-payer system. If that's the case, we're looking at an even more contentious environment than the one we're in now. Don't get me wrong. I want to see more bipartisanship around here. I want us to find more opportunities to work together and to get past the blind partisanship that currently fuels so much of what we do here and that caused 100% of the Democrats and not one Republican in either house to support Obamacare. But make no mistake, if the next administration or the next Congress tries to take us further down that path, they're going to have a heck of a fight on their hands. And it's a fight that I personally am prepared to win, so that we can eventually have a health care system that works for everyone. With that,
The Senate will be in order.
I'll yield the floor.